So I'm going to talk to you about the trigeminal nerve block using ultrasound guidance. Here we are actually targeting the V2 branch or the maxillary branch of the trigeminal nerve. Now, one of the steps that you would start with is to position the ultrasound probe on the zygoma, and the needle is actually showing the zygoma, which will look like a straight line on the ultrasound. Once you move down chordad from the zygoma, then you are going to look at the lateral pterygoid plate, and on the top of the lateral pterygoid plate is where you have a lateral pterygoid muscle. Another tip here, you will actually ask the patient to open the mouth and you will confirm that the process, the condylar process of the coronoid process of the mandible is what's moving when the patient opens the mouth. So we have a condylar process, we have a coronoid process, we have a zygoma, and we have a lateral pterygoid plate. The needling of the structure, you could do it out of plane or you can do it in plane. So you can put the ultrasound probe and you can do an out of plane approach or you can do an in plane approach to get to the V2 division of trigeminal nerve. The same target you can use to perform spinopalatine ganglion block, because spinopalatine ganglion is also located in the pterygopalatine fossa. It's in the close proximity. So injecting the lateral pterygoid muscle will allow the local anesthetic and steroid to spread into the pterygopalatine fissure, which will block your V2 division of trigeminal nerve, as well as it will also block the spinopalatine ganglion. Thank you. So we'll talk about the trigeminal nerve block, in particular V2 division of trigeminal nerve and a spinopalatine ganglion block. Both the structures can be targeted with the single scanning technique. The step one would be feeling for the zygoma and putting the ultrasound probe on the zygoma, which will give you a very much straight line. Zygoma being a bone will not allow the ultrasound to pass through. Once you have looked at the zygoma, the next step would be to move down chordad. As soon as you move down chordad, another bony structure that will appear in your ultrasound image will be the condylar coronoid process of the mandible. You can confirm this by asking the patient to open the mouth. Can you open the mouth, please? Very good. Now you can see the condylar process, coronoid process moving. Can you close the mouth? That's great. Thank you very much. So this way you can confirm that the process that you're looking at is a coronoid process of the mandible. Once you move a bit more medially, there's another bony landmark that is coming into your view is the maxilla. Entry to that will be the maxillary sinus, and we have all the structures that are concerning to us are in this view. Coronoid process of the mandible, we have the maxilla, we have a lateral pterygoid plate, we have a lateral pterygoid muscle. Muscle here is a temporalis muscle. You'll be bringing the needle in out of plane, going all the way into the lateral pterygoid muscle. Once you inject the local anesthetic and steroid mixture in the lateral pterygoid muscle, it will make its way up through the pterygopalatine fissure, and this is a lateral pterygoid plate. Through the lateral pterygoid plate and the pterygopalatine fissure, it will block your V2 division of trigeminal nerve, and it also block the spinopalatine ganglion. Just going to show you the needle positioning. For outer plane, you can bring the needle outer plane. You can also bring the needle in plane from lateral to medial. So this way, given that it could be a very steep angle, you might not be able to visualize the needle. Here I would use a hydrodissection with saline to locate the needle tip and then perform the injection. I would use non-particulate steroids like dexamethasone along with the local anesthetic mixture. 4 to 5 ml of volume in total should suffice to perform this block. Thank you.